Hello, my name is Will Stewart, and I'd like to share with you my idea for using telemedicine to help primary care clinicians in the management of patients with chronic diseases. So, a little background about the organization that I'm representing. This is a military healthcare facility that provides primary care to military family members and eligible beneficiaries. Were appropriated by Congress, so we don't bill the patient or there's not really a transaction that occurs, but we're still heavily scrutinized on the care that we deliver and the costs that it takes to achieve this. So I branded this the P2P, or patient to provider, which suggests that the patient from their originating site at home can conduct virtual visits with the provider in the clinic. So some background for why I chose this. Healthcare costs are astronomical in this country. The United States spends billions of dollars on healthcare annually, and as a percentage of the GDP, the U.S. far outpaces our economic peers throughout the globe. The U.S., in fact, is in a league on its own on per capita spending. Americans spend more on healthcare per person than countries that provide greater access and have moved to a single payer system. Yet, despite all that spending, we're not achieving better outcomes. In fact, over half of Americans suffer from chronic conditions, with a third having two or more. In fact, 35% of all healthcare spending is for less than 9% of the population who have five or more chronic conditions. Their costs rise dramatically with the number of chronic conditions a patient has. And with many of them on Medicare, the costs are shifted to the taxpayer. The chronic conditions most prevalent are related to hypertension, high cholesterol, allergies, arthritis, and mood or anxiety disorders. For our organization, it's not much different, especially our older retiree population. So, in the use case of telemedicine for the management of patients with chronic diseases, we are targeting five areas that have the highest utilization and cost: hypertension, hyperlipidemia, allergies and upper respiratory conditions, diabetes, and asthma. So these are our goals. We are primarily striving to achieve the triple aim of improving health, reducing costs, and to provide a greater experience of care through quality and satisfaction. As a patient-centered medical home, the practice can also achieve some improvements in productivity by eliminating unnecessary face-to-face visits through telemedicine and create access for those who need to come into the clinic but can't. Our vision for the P2P program is to empower our patients to manage their health. When patients are engaged in monitoring their own behavior, they have a greater chance of achieving their health-related goals. Often we see our patients, even our elderly patients, using their smartphones or tablets within the clinic. So our population is very connected and comfortable with technology. They're using health and fitness apps on their devices. Now, some of them only use them to count calories or track activities, but others use them to manage data from their home monitoring devices. And since most home computers and laptops, along with smartphones and tablets, have cameras built in to facilitate video communication, there's so much versatility that's readily available out there as far as technology is concerned. So there really isn't a better time to capitalize on these capabilities in healthcare. The concept for P2P is fairly simple. The providers will communicate with their patients via virtual technology to monitor and manage their care. They're choosing established patients who meet certain eligibility requirements, and they will be invited to participate in the program. These patients will have one or more chronic conditions, but they will have sufficient health literacy and also comfort with using technology that they'll agree to virtual visits from home. The interface occurs through a portal that's cloud-based and is HIPAA compliant and is secure, and there's no software required as it's part of the service, and patients can download the app for free or use it on their phone and tablet. So when researching possible vendors, this was the most important criteria, which was to complement the existing infrastructure and hardware found in the home or the clinic, but it also provided HIPAA compliant platforms and data security. it needed to be customizable and scalable because the environment is constantly changing as advancements happen pretty quickly, and so we needed something that could allow for growth or changes with the technology. We are also interested in gathering the patient-generated health data for integration with the clinician and inclusion in the EHR. American Well is a leader in the telemedicine industry, and they met all of our requirements for this program. They have a customizable platform, and it's compliant with HL7 Fire, so it supports data integration from existing applications that can be shared with the provider for inclusion in the health record. Many of our patients have scales and thermometers in the home, and many of them now through Bluetooth can connect to their smart devices. But we have many of our chronic diseased patients that are using FDA compliant technologies, such as blood glucose meters, peak flow meters, and pulse oximeters. And this information is readily available on their phone or on their computer. So with the American Well platform, we can actually pull that data in and share that for possible inclusion. Even data from consumer health applications for tracking activity or calories. It is my belief that telemedicine via mobile health technology is perfectly suited to support the chronic disease management of patients. By facilitating self-management and collaborating with their providers through existing technologies, patients can achieve greater outcomes and minimize their risk for emergency room visits and hospital admissions. The financial burden associated with chronic diseases can also be lessened, enabling greater experience of care and ultimately moving us closer to achieving the triple aim.